Hi. So we'd like to welcome everybody to our edition today. We're going to be talking about natural treatment for fatigue and tiredness. So I'm excited to share this with you. And I would just like to ask how many of you feel like you actually have optimal energy, all the energy that you would like to be able to have or that you feel you should have? And how many of you feel tired all the time or feeling tired quite a bit of the time? So there can be tiredness, and then there can also be fatigue. And fatigue tends to be more significant, but we're going to be talking about some of the different causes of fatigue and tiredness, and about the different natural treatment options that there are, and really about treating the underlying cause. So I'm excited to share all of this with you because this is one area that oftentimes it's really not adequately addressed, or there are many things that are often overlooked in conventional medicine. So an analogy that I'd like to share with you, if we think about really trying to get to the root cause and treating the underlying causes. So if you, for example, have an oil light on your car that goes on, and so then you take it into the mechanic, and then they say, okay, we'll take care of it. And then after you get your car back, they say, okay, problem's fixed. Oil lights off, and we took care of the problem. And so you ask them, okay, what kind of oil did you put in the car? And they're like, oh no, we didn't put oil in the car. We cut the wire to the oil light, so the problem's fixed. The oil light's off. The oil light, that came on, that warning light, it's off. So now the problem is fixed. And it's like, no, wait, you didn't treat the underlying cause. You didn't fix the underlying problem. The problem is that the oil is low and we need to fill the oil. But yet that was the solution, right? It was just, okay, we're going to cut the wire to the light. And then now the problem's fixed, right? Wrong. And as absurd as that may sound, that is very frequently the way that many symptoms are addressed in conventional medicine, unfortunately, that it's just masking the symptoms. And there are, of course, times when we need to treat the symptoms, and that can be important, but it shouldn't be a replacement for figuring out what is the underlying cause, what is the underlying cause of these symptoms. Because whenever there are symptoms in the body, it's a sign that there is something going on. The body is sending a warning light, turning on a warning light, trying to figure out and tell us there's something that's not right. There's something that's going on, and we need to address that. And well, a lot of people, if they feel tired, they might use energy drinks or coffee or soda. Those can mask the symptoms, but the real question is, what's the underlying cause? So when people come to my office and they are complaining about fatigue or low energy, then there is a whole workup that I do, and I do a thorough medical history. So the most obvious thing, the first thing that I start with is your sleep. So how's your sleep? Are you getting enough sleep? Most adults really need, ideally, between 7 to 8 hours of sleep a night. And they also need good quality sleep. So, for example, if there is light coming into your room, even if it's small amounts of ambient light, lights from the street, then that can still interfere with being able to get a good, deep quality sleep. And the reason for that is that melatonin is made by our bodies naturally to make us sleepy. But melatonin is degraded by light. So even if our eyes are closed, for example, if you have the light on in a room, but you have your eyes closed, and you turn the light on and you turn the light off, you can usually tell the difference between whether the light is on or off, even if your eyes are closed. And that's because light can still get through our eyelids to a certain extent. And what happens is when there's light that hits the back of our retina, even when our eyes are closed, that can still affect the melatonin. And whenever there is light that gets through and hits the back of our retina, then that will trigger a response in our body to say, hey, we need to break down melatonin, because that's the body's natural way of triggering a breakdown of melatonin so that we wake up in the morning. So that's why when it's light outside, we're supposed to wake up. However, for most people, we have street lights, and if you're not living in the country or rural area, if you're living in the city or a suburban area where there's lights, street lights, even night lights that are on, that can still interfere with your body's melatonin production when you're sleeping. And so I often recommend, if you are in an area where you have lights coming into your bedroom, I often recommend getting blackout curtains, or trying to do everything that you can to make the room as dark as possible. For children typically need more sleep. And even teenagers, studies show that teenagers often need more than 8 hours of sleep to support their growing brains and their body. Younger children often need ideally between 10 to 12 hours of sleep a night. And even with teenagers, studies showed they often need more than 8 hours of sleep a night. But how many of our teenagers actually getting even 8 hours of sleep a night? So those are things to consider. And there's a lot of children also that I see with ADHD, difficulty with focus and attention, where that can actually be an underlying cause of ADHD. If they're not getting sufficient sleep, then they often are not able to focus and pay attention and have their brain working optimally. And there's even some theories that one type of ADHD may actually be a sleep disorder that has been misdiagnosed as ADHD. So that's just another thing to keep in mind. Another cause of fatigue can be medications. So there are certain types of high blood pressure medications, like beta blockers, like propranolol or atenolol, which can cause fatigue. There's a number of other medications that can also cause fatigue. So if you're taking medications on a regular basis and you're constantly tired, you can ask your doctor or the pharmacist, or look at the package insert to see if any of the medications that you're taking may be causing fatigue, especially if you're getting sufficient sleep. And there are also some other supplements that may cause fatigue inadvertently. One example is 5-HTP. That is a supplement that's pretty commonly taken to help with depression or anxiety, and it can be very helpful. 5-HTP is an amino acid that makes melatonin in the body as well as serotonin. So because it makes more serotonin, it can help with depression and anxiety in some people, but because it also makes melatonin, it can also cause people to be sleepy. So looking at the medications and the supplements that you're taking, that's one thing. Another thing, if people are getting all the sleep that they should be getting, ideally, if they're getting, say, 7 or 8 hours of sleep, and they're not waking up during the middle of the night, and they say, doc, I'm sleeping through the night, but they are feeling really tired when they wake up, that could be a sign of sleep apnea. And I have a number of people who have said, I get 8 hours of sleep, but then when I wake up in the morning, I just feel drained. I just feel exhausted. It feels like I haven't slept at all, or maybe I only slept like 1 hour. So if you're one of those people, there may be sleep apnea going on. And there are different types of sleep apnea. People classically think of sleep apnea as a really large, overweight man that snores a lot. And that is kind of a classic picture of sleep apnea. That being said, I've seen a number of patients where they are not overweight at all, and they're not men, they don't snore. They have never had their partner tell them, oh, you look like you stopped breathing during the night, or where they have difficulty breathing. They're not waking up consciously during the night. But if you have sleep apnea, there are a number of cases where people don't fit that classic picture, where they're not overweight, they're not men, they're not snoring. Their partners never told them that they stopped breathing, but they just wake up and they feel really, really tired in the morning. And so if that's the case, sleep apnea could be going on. And what is sleep apnea? Sleep apnea is basically where your body is not getting enough oxygen. And so that can be caused by a number of different things. It can be caused by enlarged tonsils, or if you're overweight, extra tissue around the throat. And when you lie down, that tissue collapses on the airway, and so it prevents you from getting the oxygen. And so what happens is that your body, because of course oxygen is important, your body will trigger you to wake up and will to stimulate you to start breathing again. And some people don't consciously wake up. In fact, many people who have sleep apnea never actually consciously wake up. But what happens is their body is jolted into a certain extent to stimulate the body to start breathing again. And so even though they don't consciously wake up, their body is subconsciously kind of interrupting their sleep, and then they don't get good quality sleep, and then they feel really tired in the morning. So that's another thing that could be going on. Other things that could be happening could be nutrient deficiencies. Some people may have anemia, which is where they don't have enough red blood cells to carry the oxygen to all the parts of the body. And so as a result, if you're not getting enough oxygen to your brain, to your heart, to your lungs, then you could feel really tired all the time. That being said, people may have nutrient deficiencies where it's not to the point that they actually have anemia yet, but they have, for example, an iron deficiency or a B12 deficiency or folate deficiency or all of the above. And if you have deficiencies in those vitamins, then that can be a precursor, or that can be something that can lead to anemia. And sometimes I see people who have deficiencies in those vitamins and are not anemic yet, but they're feeling tired. And so that's something that can be tested by blood tests and asking your doctor to check for iron levels as well as B12 and folate levels. Sometimes people say, well, I have a good diet, but I showed up with these nutrient deficiencies and I don't understand why. For example, iron. I eat tons of red meat, which is a good source of iron, but it showed that my iron levels are low and I don't understand. Or some people are taking iron supplements and they're still low. So why is that? There may be underlying issues behind that. For example, you need your stomach acid in order to be able to absorb iron and B12 and folate and other B vitamins. And so if you don't have enough stomach acid, then that could be an underlying cause of why you're not having enough iron or B vitamins in your body and why you're not absorbing those nutrients. Because if you don't have enough of the stomach acid, then you're not able to absorb those nutrients, and then you have a deficiency. Another common thing is that it's very common that people take acid blocking medications. So for example, if they get heartburn and they're taking Tums all the time, or they get heartburn, their doctor prescribes omeprazole or Nexium, which is the purple pill, or other types of medications, or if they're taking these medications over the counter. And these are readily available medications. That being said, people don't often realize the harm that can cause long term. Because if you're having acid reflux, my experience is usually that there's some type of food or some kind of digestive issue that's going on where people aren't digesting their food well. And so we need to do food allergy or food sensitivity testing to figure out why. But a lot of times people will just take acid blocking medications all the time. And then as a result, their stomach acid is low, and then they get deficient in these vitamins and nutrients, and then they feel tired. And you may not realize that taking omeprazole all the time or other types of acid blocking medications may actually be a cause of you feeling tired all the time, because it's not a typical side effect that we expect with that medication, but it can cause a series of other medical conditions that can then subsequently cause you to feel tired. So those are just some things to keep in mind. Another common thing that I see is low thyroid function. Many people go to their doctor and say, I'm wondering if I have a thyroid problem. Can you test my thyroid? And so then their doctors test something called TSH, and that's a test that stands for thyroid stimulating hormone. But and so for many people, they go to their doctor and they get it tested, and then they say, oh, your TSH is fine, you don't have thyroid problems. That being said, I've seen many people who have autoimmune thyroid problems, something called Hashimoto's thyroiditis, where their TSH is completely normal. And if we test their thyroid antibodies, then we find, oh, they do have thyroid antibodies. And that can be an underlying cause of thyroid problems, which can cause fatigue or low energy. But with hypothyroidism, it's really important to do a thorough screening for thyroid problems. So most conventional doctors, like I said, will only test TSH. When I test patients, I will do a number of other thyroid tests and do a more thorough workup to make sure that there's not thyroid problems. For example, another test that I'll look for is something called reverse T3, and that's something that most conventional doctors won't test. But that's something that is important to test, to do a very thorough and adequate thyroid workup. So with low thyroid function, that's another potential cause. Low adrenal function is another potential cause of being tired all the time. So that can be tested by something called cortisol. And low adrenal function, it can be tested in the morning time, but for low adrenal function, most people don't realize that cortisol, that hormone that the adrenal gland makes, is supposed to start high in the morning, and then it's supposed to go lower throughout the day. And most blood tests are only, of course, done once in the day. And then we don't get a really good picture as to what the cortisol levels are during the rest of the day. So I often will do salivary testing or saliva testing for cortisol and test at 4 points throughout the day. So that way we can see what is the cortisol level in the morning, midday, afternoon, and evening. And I've seen a number of patients where their cortisol might be normal in the morning time when you would normally get a blood test, but their cortisol is low at other points in the day, like in the afternoon. And so those are things to look for. Other potential causes, there may be dehydration, low blood sugar, a number of other potential medical causes. So with dehydration, of course, that's something where you need to make sure you're drinking adequate water. But it's a simple thing that a lot of people don't think about, that, oh, if I'm not drinking enough water, maybe that's why I'm tired. But that is a simple thing to look at. And low blood sugar can also cause your energy to crash. The characteristic of that is that if you go a period of time, like several hours, where you haven't eaten, and then you find that your energy is just tanking, then that can be a sign of low blood sugar, or problems with your blood sugar being able to normalize. So what do we do for that? For blood sugar problems, a lot of times people, when their blood sugar is low, they'll eat some kind of sugary food or drink soda or candy or things like that to get their blood sugar back up. And that can be important and appropriate, particularly if someone has diabetes, where their blood sugar could be so low that it could be life-threatening or cause serious problems. So that can be important, and it's fine to eat sugary foods at that point. However, on a regular basis, if people are eating sugary foods all the time, what happens is that when you're eating sugary foods, your blood sugar will spike and then it'll crash. And then when you hit that crash, that's when people tend to feel really tired and sluggish, and they feel like they have brain fog. So those are things to keep in mind as well. So how do you remedy that? If there is low blood sugar, then I tell people, for the most part, unless their blood sugar is really seriously low, like if they have diabetes, I tell people, for the most part, to avoid sugary foods and making sure that you're eating enough protein and getting good fats in your diet, because the protein and the good fats will help to keep your blood sugar more stable throughout the whole day. So protein, that can be found in nuts, seeds, beans, in fish, and in meat as well. So in poultry and red meat, things like that. And good sources of good fats include things like good quality oils like olive oil, coconut oil, cold pressed organic oils. There can also be good sources of fats in fish, also in nuts and seeds and beans, and also in not in beans, nuts and seeds, and then also in meat as well. So for meat, I usually will recommend trying to get organic meats because that can be important because those don't have added hormones and other types of things in them. And there's a number of other conditions that we can talk about. Autoimmune conditions is another one. If people are feeling tired all the time and they just can't figure out why they're tired and they've been tested for a number of other things. So things like lupus or Sjogren's or even rheumatoid arthritis, other types of autoimmune conditions can cause fatigue. And an autoimmune condition is when your immune system, which normally should attack things like bacteria and viruses to protect you, to keep you from getting sick all the time, instead of attacking those kind of things, your immune system is attacking your own body, and that can cause fatigue. And so that's something that should be screened for, and it's often something that flies under the radar for many conventional primary care physicians. And so that's definitely something that should be checked. And that can be screened for with a blood test called ANA, or anti-nuclear antibody. And there are other tests as well that can be used to screen for autoimmune conditions. So if I'm suspecting that in patients, then I will usually look at that. Also, food allergies or sensitivities can also cause fatigue and digestive problems and other types of things. So this is not by any means an exhaustive list. There are a number of other conditions that can cause fatigue and low energy, but these are common things that tend to be overlooked very frequently in conventional medicines. That's why I bring up those conditions. And so some of the things that I want to share with you, I would like to share with you a case of a patient that I saw a few years ago, and I've treated a number of patients with fatigue and just chronic low energy. And so this is a case that I think will illustrate one potential type of low energy. So this is a patient who had both Hashimoto's disease, which is an autoimmune thyroid condition, as well as type 1 diabetes. And she was having low energy. She had difficulty losing weight, and she also had a lot of brain fog, which is often described as difficulty thinking clearly. It's kind of like you feel like your mind is in a soup and you can't really think clearly. And so that's something. And so she was continuously gaining weight due to her diabetes. And she talked about it being kind of like a catch-22 because she would have to take more insulin to prevent her, to keep her blood sugar from getting too high, but the insulin would cause her to gain more weight, and so she just couldn't lose weight. And so one of the things that we looked at is we looked at a number of things to figure out what's the underlying cause. And some of the things that we did is that I did a number of blood tests. I looked for food allergies as well as food sensitivities. I tested her hormones and also looked for signs of overgrowth of yeast or bacteria in her intestines. And what we found was that she had a number of food allergies. She also had some food sensitivities. We also found that she had low adrenal function. And I had briefly mentioned adrenals and thyroid before. Most people don't realize that the adrenals and the thyroid are really important and that they work together. And often when people have low thyroid function, there often is problems with the adrenal glands as well. And that what can happen is if the adrenal gland is low and the thyroid is also low, and those two glands talk to each other, you try to treat the thyroid with medication, but what happens is that the adrenal glands, if you're not addressing that, then that imbalance is still going to persist and you're going to have problems with the thyroid. So whenever I have someone with a thyroid problem, I will always look at the adrenal glands as well, because that's really important to treat the adrenal glands as well as the thyroid. And if you treat both, then you can have more success in helping to balance out both of those. So adrenal glands can be, low adrenal function can be treated with herbs. It can also be treated with other types of natural remedies. And so we did find that that particular patient did have low adrenal function, and that was something that was contributing to her thyroid problems. And she also had an overgrowth of yeast in her intestines. So what we did was we started by treating her for the overgrowth of the yeast. And she reported that within a few days, she felt a huge difference. She said the brain fog was totally gone. Her blood sugar was better controlled, and she wasn't having constant allergic reactions. She also took out those food allergies and sensitivities that she had. And we started treating her low adrenal function with herbs. And she reported that her blood sugar was able to be better controlled. She was able to reduce the amount of insulin that she had to take, and that she also started having better energy. She started being able to lose weight. And so that's an example of a case where you have a number of other things that are underneath the surface. And it really requires doing a more thorough intake, taking a careful medical history, and doing thorough testing to be able to try to figure out what is the underlying cause that's going on with this person. So if you are having low energy, fatigue, I invite you to call my office. I do offer a free 15-minute phone consult, and that's something that can be helpful so we can be able to talk about the symptoms you're experiencing, be able to come up with a plan to be able to help you the most, and try to figure out what's the underlying cause for you and why are you having that low energy, and what do we need to do to help get you on the road to healing and wellness. So I hope that you learned something from this presentation. And if you find that this is something that you feel would be beneficial to friends or family, feel free to share this video with them. Looking forward to our next episode that we'll be talking about other things, other health conditions. We invite you to share with us by sending us a message on Facebook, or leave me a comment in this post about other types of health conditions that you would like to hear about and learn about. So I'm looking forward to hearing from you, and thank you again for joining in. I see you, Vera, and hope that you found this helpful and that you learned something. And again, so aloha. And also a happy belated Mother's Day. It's the day after Mother's Day today, so just want to wish all the mothers out there happy belated Mother's Day, one day late. Okay, take care and look forward to seeing you. We'll have our next Facebook Live, which will be in another few weeks. Okay, aloha.